you actually were at a decision point with technology, Shawn.
Right.
And so you think about delighting, you didn't sound like you were delighted as you were sitting with this decision. Can you tell that story?
Yeah, so this is, of course, back before we met Carium and had the partnership that we do today. But we were building our capability to deliver delightful services to patients. And part of that is really a twofold aspect. Number one, our folks that deliver the care, and we call them care navigators, right? They provide the care coordination, the chronic care management services, the remote patient monitoring, data collection and interpretation, the communication with the patients. We have to be able to document care about the patient. That care navigator is spending, blocks of time, 20-minute, 30-minute blocks encounters that are paid for by Medicare and private insurance, or even our subscription subscription offering that provides more and greater attention. We're still managing that interaction with the patient. So, we're providing clinical encounters and we have to document care on those encounters. That's the first area that we need technology to enable that capability for our care navigators. The second is patient engagement. We need to be able to share information. It's a requirement for Medicare that a comprehensive care plan be accessible to and available to the patient of what we're doing to help them manage their chronic and acute conditions. So we have to engage the patient. We have to make them knowledgeable of their care plan. We have to help them with the steps to comply with that care plan. And then we have to give all of that information to our original customer. The patient is the customer of our customer, right? So our customer being the clinical practices, hospitals, senior living communities, we have to provide that information as well over. So we had started with a company that you would recognize if you heard the name, a very, very big organization. And they had a platform that was kind of built around, here's what we do. You need to go hire an implementation team that's authorized to work on their platform to customize the solution to create the workflow that you need for care documentation and the steps and interaction that you need for patient engagement. And unfortunately, that was already out of the chute, it was, expected to be a 5 to 6 month effort. But when it became a 10, 11, 12-month effort, we kind of decided that this really wasn't the right platform for us to be working with. So, we have to have the solution to document care. There's no way that our care navigators can be productive without documenting care. We have to be able to engage the patient. There's no way that we're going to have a delightful interaction if we don't have a good system that engages the patient. And unfortunately, that prior partner, or maybe fortunately, because now we're working with Carium, wasn't able to deliver that for us. So we went on a search for the right partner.
So when Shawn came to you and, had this problem, said, gosh, we are really looking for a different type of solution. Tell me a little bit about what happened at that juncture.
Sure. Yeah. A couple things happened. One, I remember one of our interactions, Shawn emailed me a list of technologies and just said, hey, what can you do with this for me? And so I think the ability to consolidate a lot of that into a platform with our partner here has been great. That alone is great. There's a lot of cost savings in that. There's a lot of efficiency in that for Shawn and his team. But I would say the other great thing about it, beyond just kind of answering the bell, right? When Shawn sent me that, is a lot of those updates that I talked about at the beginning of the call. Mm-hmm. It's really important to note, we don't have a bunch of folks just developing things in a vacuum because we think it's what's next. Partners like Shawn and all of our valued partners are who's driving that, right? One of the things we talk about at Carium all the time is we're not building anything just because. Mm-hmm. So if it's on that list of releases, someone's asked for it, someone's partnered with us. And a lot of those kind of things that deal with customer relationship management, reaching out to the patient, multi-channel communication, all of those kind of things are coming from partners like Shawn saying, this is how I want to take care of folks. Mm-hmm. Back to his culture. This is how we want to delight folks in the healthcare space when we take care of them. And so I just think it can't be overstated how important that is to anything that we produce.
Well, and I think
I'm going to interrupt you, Julie, because I have to add on to this.
Go for it.
I remember giving Rich that laundry list of feature functionality and thinking to myself, there's no way he's going to say yes. to the majority of this, because of course the prior vendor, just adding on to the fact that it was a platform that had to be customized. If you wanted to do more things, they were integrations from other companies that you had to pay for services for video, for example. And don't get me wrong, Rich, I heard you just a few minutes ago talk about integrating other videos, but you have a HIPAA compliant video service, built into your platform. So when with the prior vendor, that was somebody else's add-on that you're going to have to pay to do video. If you wanted to do HIPAA compliant messaging, that was an add-on. If you wanted to go through and find a way to communicate with your patients through automated notifications, that was an add-on. So add-on gets, you can see the expense going up and the complexity going up. So the fact that Carium has this literal all-in-one, for our viewpoint, documentation platform where our care navigators can come through, they can see a list of our patients, they can understand all of the data that's collected from the RPM world, they can establish care plans, they can send them notifications, they can send them content and information on health and wellness, they can build out a plan, they can schedule appointments, they can have a video consultation, they can message in the app, they can email in the app. All of that makes it an incredible platform. And we haven't even talked about the patient's view of that yet and what their experience is. But we haven't found, and by the way, we looked at other solutions other than Carium. We didn't find someone that could have answered that laundry list. So I don't know, it was a little it was surprise. It was an understatement that Carium had all of this out of the box, plus the ability of using them as a platform to create very unique things, which we can talk about in a little bit.